Huge welcome to everyone. Thank you for joining. See, we have about 55 folks on the line, and I expect that number will go up. My name is Julia Anderson. I'm the COO at CanWaCH, and I'm really personally and obviously professionally excited about the webinar today on menstrual hygiene in fragile and humanitarian contexts. I speak often about the entry point. So at CanWaCH, we take a comprehensive approach to health. So we're thinking about all the various points and entry points at all times and try to keep our eye to them. But it's so, I think, encouraging and compelling and motivating to go deep on these different entry points that we have passionate people around the world working on. So I'm really excited about doing that today, and hope that you as the experts on the line and the professionals on the line are able to take a lot away from this call, and that it spurs action as we go forward. I'm joining from Peterborough today. My hometown has been my hometown for some time, the traditional territory of the Mississauga Anishinaabe people. I've had the great honor and privilege of learning from many elders in this community, and actually elders who have come from other communities as well, and congregated at the university where I studied and took my master's in Canadian and Indigenous Studies. So I hope as whenever I speak publicly that I can do honor to that teaching and those legacies that they've actively engaged me in over the past years, and I hope my words today honor that. So before we dive in, the other piece that I like to acknowledge on these calls is that we're all working from home. So I know the speakers, we did a collective sort of take, and I know some of the speakers are nervously wondering if a cat is going to jump up on their desk, or a kid is going to run in and make an appearance. And I know at home, many people are struggling to kind of multitask and really dig in and pay attention when we're doing so many jobs all at once. So I don't have a solution to that challenge, nor does anyone, but I do want to acknowledge it and appreciate that though we have time works differently in these COVID times, your time is still super valuable, and we've tried to think long and hard about that in the preparation of this webinar. So I hope we can make it worthwhile for you. You're here because you know that periods don't pause for pandemics. We think about this a lot when it comes to a whole range of reproductive health issues. They don't just stop when a pandemic arises. We can't put them on pause. We can't hold them off. In the lead up to Menstrual Hygiene Day, which is on May 28th, we at CanWaCH have been doing a fair bit of work with digital events, this webinar, and others. Because we really want to spark this conversation. We really want to dive deep on this entry point, because it is one of the more marginalized entry points when it comes to women's health, whether it's because it's taboo or whether it's because we're just not accustomed to speaking about it as an issue on its own and in its own right. We know that it's a conversation that needs to be elevated and amplified. We know that women make up 70% of the health workforce, and around the world on any given day, 288 million people are menstruating, and 1 in 4 of them have to get on with their day without any products and supplies. Inadequate water, hygiene, sanitation, the wash facilities, as well as just the knowledge and awareness of how to effectively manage their period can have devastating effects on attendance at school, taboo within the home, and all kinds of things. Supply chain may not be the sexiest of issues to think about, mostly because it's complex and large and feels out of our hands, but it is a critical entry point to addressing menstrual health issues. And certainly with the current pandemic, supply chains in general, just the notion of supply chains are actually getting on the news, and people are thinking about them because developed nations, for wealthy nations. We're being impacted here. And so I think this is a real opportunity to make supply chains a conversation that people start to wrap their heads around. And that's what we were thinking about as we launched this today. So we have two portions of this webinar. We're going to start with a conversation about domestic, a little bit more focused on domestic issues with Sussanne Skidmore. She's the Secretary Treasurer of the BC Federation of Labour and the co-chair of the United Way's Period Promise campaign. And she's based out west in BC, and we'll talk a little bit about what's happening with Indigenous communities, but also just in Canada more generally. After that presentation, we'll move to our panel discussion, and we'll have a couple questions for our speakers. We have an amazing list of speakers that include Sussanne, Dr. Henia, as well as Paul. Dr. Henia Dakkak is the head of policy and liaison unit of the Humanitarian office at UNFPA. She has many years, over 16 years of experience working in humanitarian preparedness, emergency response, disaster risk reduction, recovery, and resilience on a range of programs, including SRH and gender-based violence and menstrual hygiene. Paul is the co-founder and CEO of AFRIpads Uganda Limited, which he and I believe his partner started in 2009. AFRIpads has scaled from a seed idea to one of the leading manufacturers of reusable sanitary pads in the world, having distributed over 3.5 million products across the continent of Africa and beyond. We're really excited. I got a little goosebumpy at our prep session when Paul and Dr. Henia started talking and made a connection, have worked with one another's agencies and whatnot, but we're able to have a conversation as a result of this webinar. And I hope that there's other conversations that are also spurred out of this webinar. So with that, Sussanne, I will turn it over to you.
Great, thank you, and thanks for putting this together. I'll save some time. You've already introduced me. I do want to acknowledge the land that I am on. I'm actually in the office today, the only person in my office here, and we're in Vancouver. So it's the Coast Salish territories for the Squamish, Musqueam, and Tsleil-Waututh peoples here, and incredibly important to acknowledge the land that we're on and the impact of colonialism and poverty and all the work that's being done across the country as we move forward and come out of COVID, and hopefully come into a new normal and take into consideration some of the wrongs of the past and see if we can find some ways to come into it in a better way and do good work in a good way. So my name is Sussanne. My pronouns are she, her, and hers. And I just want to talk a bit about sort of what we've been doing with the United Way. And so it's the United Way of the Lower Mainland. And we've been working in the field of period poverty for the past 4 years. So in 2018, we launched the Period Promise brand. So we have been doing collection, campaign, as well as we have a policy agreement. We're doing some work in the research field, as well as community mobilization and government relations. Our COVID response has been to try and integrate some of the work we do into the food hubs that have been set up, and we have partnerships with the United Way across the country, so both under the branding of Tampon Tuesday as well as Period Promise. So, talk a little bit about the situation here in BC, and likely very similar context across the country, I would imagine. As most folks know, there's no data on how period poverty is changing as a result of COVID, because of course it's happening in the moment, but it's part of how people who menstruate experience poverty. So job insecurity is on the rise, food insecurity is on the rise, and we know based on government numbers that women are experiencing unemployment at a higher rate than men as a result of this crisis. We also know, based on research and anecdotal data collected over years of work, that period poverty is very closely linked to food insecurity. So people who experience chronic poverty will often say that they are forced to choose between buying food or tampons or products. We can safely assume that more people are facing that challenge these days. Most people who experience period poverty rely on community organizations and agencies to provide them with products. Frontline community organizations have had to change their points of contact with vulnerable populations during this crisis, canceling programming that would have had members of the public coming into their organizations, closing their doors to the public, and many have had to alter their outreach strategies to being fully digital or done through the telephone. So as a result of this, vulnerable people are having a very difficult time finding points of access to those community organizations and to the products, to menstrual products. So they can no longer, go to a neighbor house and ask for a box of tampons that might support them for the next month. They might find them in food banks, and some of the organizations that are partnering with the United Way are working to provide products in any of the hampers or outreach materials that they're providing. But the access to menstrual products for vulnerable people has always been complicated, and depending on knowing where to find products, this knowledge is often communal, shared by a network of people who have experienced hardship and built up tools of resilience together. So the newly vulnerable population, people who become vulnerable as a result of COVID-19's economic impact, do not know where to find product and are less likely to have access to the networks where this information could have been housed or shared or chatted about because of the restrictions that people are living under. The supply chain to organizations is also broken. So most charitable organizations largely rely on donations or broader collection drives, as they don't have the funding to allow them to purchase products. The United Way of the Lower Mainland's Period Promise collection campaign collected more than 800,000 menstrual products in the Lower Mainland, Fraser Valley, Sea to Sky corridor in 3 years of campaigning by engaging thousands and thousands of donors through our existing networks and partnerships. So we've also had to pause in the middle of our 4th year, interrupting the collection and the mobilization effort, which will likely reduce the size of the campaign, making it more difficult for us to support partner agencies when they could use it. And so the scope of the disruption is difficult to explain, but it's inevitable. We know it's happening. So across the board, sustainable financial and in-kind donations to frontline nonprofits, are down because people are respecting social distancing requirements. The impact is substantial. As many as 20% of nonprofits in BC might have to close in the next 6 months because of the financial impacts on the sector. And that will also have long-lasting impacts on folks. So the United Way of the Lower Mainland has a network of more than 500 partners. We have community agencies, unions, businesses that we use to mobilize and leverage the issues around period poverty. And through the different United Ways across the country, including and the Canadian Labour Congress, we have a shared partnership that has the two groups working together to support common interest in building up diverse and inclusive, healthy, and accessible communities for everybody. So Period Promise started as a partnership campaign shared with the labor movement. Labor movement's ideals of gender equity, justice, solidarity with vulnerable populations layered well with the goals of this campaign. And they quickly understood the core issues of period poverty and worked to educate and mobilize their membership on the issues. This has been a great mechanism for identifying and making use of male allies, and unions like my own union, the BC Government and Services Employees Union, and the Health Sciences Association of BC, and Move Up pushed the United Way to expand the campaign from a collection model to centralized policy change and momentum building. Unions are willing and able to be political in ways that charities often struggle with and are unable to, and we are able to directly petition and lobby government and decision makers. So we've done that in partnership with the Period Promise campaign in a manner that is coordinated with the United Way of the Lower Mainland, but which the labor movement takes ownership of, and it's had an incredibly big impact. So one of the examples of that is through the BC Teachers Federation, the BC Federation of Labor, lobbying the Minister of Education, Rob Fleming. We are, able to move the dial on a lot of public policy that actually has changed people's lives. For example, here in British Columbia, we have a project to have products available in all of the schools across the province. It's been, it's had some bumps along the way, but it's provincial policy now. It's a pilot project, but it will likely move into being moving forward as a policy. Of course, it has its challenges, as we know that schools are closed and students haven't been going there, but we've been working with the BC Teachers Federation and the ministry to try and find ways to find access points to the products that are in the schools, that have been purchased for the schools, and all of that. So there's been some great work going on. I think that's probably a good news story to at least in the circumstances to end with. And yeah, just thanks again for pulling this together. It's such important work that we're really committed to here. So.
Thank you so much, Sussanne. I think you raised a lot of the critical points, and as I always find it interesting that when we're discussing issues sort of here at home and abroad, how many connections there are. And, we have a lot more that's similar than there is that's different, aside from sort of resources, the political will to mobilize those resources is still what it takes. And I congratulate all the folks in BC who did get that big win recently for piloting, but also just, it got in the news, there's awareness raising, there's, it caused a federal response. And I think that is the type of work that's really critical, at the same time as, of course, getting the resources out to those in need. I'm going to turn the mic over to Paul. You were recently in China in December 2019. Well, recently for travel, because after that we all stopped traveling. And in Uganda at the start of 2020. What do you see is happening on the ground? Did you see warning signs sort of to cause you to prepare in other businesses for what was to come? And what are you seeing as the key kind of responses that people are calling forward? And you can maybe tell us a little bit about AFRIpads as well.
Sure, great. Thanks so much. And thanks CanWaCH for hosting the webinar. And also it's a real privilege to be on this panel with Dr. Henia, who, if you've taken a look at her CV, is incredible. She's brought so much change and innovation to women and girls in vulnerable settings across the world. So very happy to be here. I'll do a really brief intro to AFRIpads. We were actually started in 2009 as a pilot idea, but we incorporated in 2010. Actually, this week is a huge celebration for us, as it's our 10-year anniversary. So thank you, we're all celebrating in isolation and self-distancing. So we have over a decade of experience in menstrual hygiene management, and what we've sort of been able to come up with over the past 10 years is a holistic approach to MHM. And there's sort of a three-pronged approach that we take. One is through product. That's our reusable pads that we manufacture in southwestern Uganda, in a rural village where we first started the idea 10 years ago. Education in the form of an MHM curriculum that we provide as a training of trainers to organizations who work on the ground. And impact assessment, which we provide an easy to use sort of field-based data collection toolkit, which our partners can use to gauge the impact of their MHM. We have offices in Kampala, our factories in southwestern Uganda, and we also have another office in Nairobi. And as you mentioned, we've been able to reach 3.5 million women and girls with our products over the last 10 years, worked with hundreds of NGOs across Africa and around the world, and have 175 employees in East Africa, proudly 90% of which are female. So I think maybe I'll start with sort of my perspective on how COVID has impacted, AFRIpads is really global. As you mentioned, I was in China in December, which is only about 5 months ago, but seems like a decade ago, especially with the current situation. We have most of our suppliers there for our raw materials because we're not able to source the fabrics we need in East Africa. We go every year to check up on our suppliers, and I was there in December, and honestly speaking, it was business as usual. I mean, I was taking internal flights, speed trains to, bullet trains to go visit various suppliers, and there was nothing out of the ordinary. This was right before Chinese New Year's, which is really important for anyone working with companies in China, because for about 3 to 4 weeks, China completely shuts down. So after I got back, still there was no signs of anything out of the ordinary. And by the time we got back, we started getting messages from our suppliers saying, we're not really sure when we're going to go back to work, because the first death was recorded on January 11th of COVID in China. And from there, it really started to spiral. Luckily, the factories that we work with were not as badly impacted in the areas like Wuhan and Hebei. So they were able to sort of get their production back up and running. But in the meantime, we realized, and a big learning lesson for us as in regards to supply chain, is we may have 2 to 3 suppliers of our raw materials. They're all based in China. So if an economy has a major issue like a natural disaster or a government collapse or a pandemic, we are completely reliant on that economy. So we started looking into Thailand, Indonesia, Turkey, but it seemed like the virus kept following like a tidal wave across, and into Europe. So we really had to sit back and think about, how do we pivot in this, moving forward, and make sure that we can still have sort of a strong supply chain, if something like this happens. So around the same time, maybe I'll stop there for the moment, but around the same time, it was business as usual in Uganda. And obviously now that has changed dramatically as well.
Yeah, very interesting. And I think a lot of businesses, both social good and otherwise, are struggling with the same thing. It's like people didn't necessarily think about that reliance as predominantly as we're now thinking about it when it comes to all the various building blocks of a given product or food supply chain or whatnot. Right. So Henia, I know that the UN has been doing a ton of work, has had to have a coordinated response, be the gatekeeper of this crisis in so many ways. Can you speak a little bit about supply chain readiness, preparedness, and what that looks like in fragile and humanitarian settings, thinking especially about the fact that we're probably going to see an expansion of the number of fragile and humanitarian settings over the course of the next years?
Yes, thank you so much. I just want to iterate that UNFPA, as United Nations Population Fund, stands for the Sexual and Reproductive Health Agency, basically, of the UN. So definitely for us, the issue of menstrual hygiene is part and parcel of the reproductive health agenda. And therefore, we cannot just make it different than whatever we need to do in order to support women and girls during this period, whether it's COVID-19, whether it's emergencies, whether it's post-emergency situation, pre-emergency situation, we have to still continue working. So we are there before, during, and after, and therefore the issue of menstrual hygiene is paramount, and it is part of the reproductive health agenda, and it's part of the human rights agenda. And I just want to make sure that this issue is being, understood as part of women's ability to access health care, as part of the right to health, as part of the right to dignity, as part of the right to work, as part of the right to education. And it's also about, making sure that there is no discrimination. Because a lot of times when we are talking about menstrual health, there is a lot of discrimination and there are many taboos. And so that we make sure that there is no discrimination. In terms of COVID-19, in terms of what we are having to do now with the supply chains globally, is that definitely in many, many places, what we have been advocating for over the years, since UNFPA has been working on humanitarian situations since 1994, and before even that, we have been advocating that we need to make sure that supplies are available for women and girls, because in order to have service, you need the supplies. So you cannot have a service and information without really the supplies that support that. So the idea of really making sure that these supplies are available needs preparedness, needs, you know, a supply chain management that is really talks about what is the product that you need, how do you get that product, to where you want to get that product, which quality of that product, and, you know, to the end users. And that's the whole chain of that is now disrupted with COVID-19. But what helps us is really the preparedness. We have been able to prepare before COVID-19 for humanitarian situation. Unfortunately, these have been becoming more and more complex, more and more protracted, more and more often, and in more and more countries. So for example, for COVID-19, the UN issued a global humanitarian appeal for COVID-19, which has been, you know, like a humanitarian response plan, which has been in addition to all the response plans that the UN has put for the humanitarian situation countries. So at the moment, the COVID-19 response plan, humanitarian response plan, is for 63 countries, and we still have around 9 countries on the watch list, because we know that these countries have very weak health system, and most likely they will be affected. Whether they will be affected because the health system is weak, whether they will be affected because of the unemployment, which Sussanne has talked about, and was what Paul has said, you know, because of they cannot get the products, they cannot get the system up and running. So there is an economic and social impact of COVID-19, not only just it's for the emergency countries, which is most likely they are going to be the most affected because they have the weakest health system. And of course, they might be prepared, but they might not be as prepared as they need to be for COVID-19. Over to you, Julia. I stopped because I think we need to really get people to ask questions, and we need to really be able to support them. But supply chain has been a global issue at the moment. There is a supply cell that has been created by WHO, UNICEF, UNFPA, WFP, in order to support getting at least airlifting things from, let us say, from Geneva or Belgium all the way to Africa, specifically to Addis and to Dakkak, in order then to be transported further. But in essence, we don't even have the facility now or the cargo to get things out of Europe all the way to Africa, or from Asia all the way to Africa. So WFP has been putting this logistics cells, which is a combination of all the UN support system, which is like we are in all the countries, but this is to bring all the support system together. And that cell is really helping to get cargo all the way from different parts of the world, like I say, from China, from Africa, back to Europe, and vice versa. Because without that communication and transport ability, it will be very, very difficult to get any products out there. So that's from the UN side, but I can go on and on this because it will never end. It's too much work that we are working on doing at the moment. Over to you.
Yeah, no, that's fascinating. And also the sheer numbers that you just shared. Did you say 63 countries are on that list?
Yes, that's correct. 63 countries on the list, yes.
Yeah, I mean, that's just wild if you think about it proportionally to the number of countries in the world. Like,
yes.
You know what I mean? And yeah, the massive scale of need and how to meet that. Although I have heard speakers you know, in other webinars talk about that the work that you're doing can actually be a model for not just low and middle income countries in humanitarian settings, but actually globally, because supply chain overall, wealth used to protect the supply chain in some ways, now it doesn't, and joint procurement and these ideas as a kind of conceptual framing rather than just as, you know, in low and middle income countries as a solution around a lack of finances, could be something we look to. And what could the opportunity there be for, you know, if wealthier countries start to buy into these to manage their own supply chain and joint procurement and things, what could the opportunity be and how could we shape that? So lots to unpack there. We did want to speak a little bit, I'm going to turn it back over to you, Henia, again, just to talk about a bit more on the ground in fragile settings. So the idea of stay at home works great when you're in a country like Canada with lots of space and have access to resources, much more difficult in humanitarian and fragile settings. So what are the lessons you've taken from previous conflicts and humanitarian crisis, and how are you applying that specifically around getting access to menstrual products for people in these settings right now? What are the barriers on the ground?
Thank you. I think one of the aspects that we have been working with, and this is something that we have, I think, and Canada has been one of the countries that have really supported the work that we need to do on gender-based violence, addressing gender-based violence and addressing women's health and adolescent health, because I think adolescents are a key component. What has helped is the localization. And the idea is that we work with a local organization, women-led organization, youth-led organization to really support the communities where they are from, because that's a way of making sure that we are partners in this. They are partnering with us and we are partnering with them to really be able to reach the most vulnerable. And in essence, for us as the UN, leave no one behind, and leave no one behind is making sure that the disabled person has access to menstrual hygiene items, the dignity kits. We call them dignity kits because we really want to get it out of this, it's only for menstruation. No, it's about dignified way and manner to really address very personal issues that every woman struggles with. We know that there is at least 500 million women and girls around the world currently have no access to these supplies, okay? And the numbers are increasing. It's not decreasing. Because of poverty, these numbers will increase definitely. As Sussanne has said, as Paul has said, a lot of countries, the girls and the women don't have access to that. So from our perspective, I worked in tsunami in 2004, and one of the things that I noticed immediately when I was trying to assess the situation for women and girls, that when there was food distribution, women were not even standing in the line. Most of them were not there. And part of the reasons when I did more focus group discussion with women and girls, they could not get out and stand in the lines because some of them didn't have underwear, some of them had their periods, so they didn't have, any headscarves even at that moment. So we have to add not only the menstrual aspects, but what would make a woman dignified in order for her, or a girl dignified for her in order to stand in the line and get at least food supplies. And this is the aspects that we need to really, how do we facilitate? And for UNFPA, it's about enabling the local people to be empowered enough to get these elements to them as soon as possible. And we do work with Paul organization at the local level, getting things out to people immediately and we do local procurement when necessary. Most of the time, like dignity kits are put by women organizations themselves for women. So it's about really enabling and making sure that the response is definitely a response that is localized. And yes, you know, we are a global organization, but our response is localized to the context and to the people and to the way they feel it is important for them to remain dignified, to remain supported, and to also to be able to support themselves without us being there all the time. So we need to put the sustainability in that. So within COVID-19, we have been able to mobilize immediately resources, money, logistics support, wherever it is needed by different agencies from the UN coming together and working with a lot of international organizations, national organizations, governments to get these items over immediately to the women and girls. But at the same time, it is also what available resources at the local level that we could bring on the table to really support the women and girls to be able to do the work that they need to do immediately so that they can support themselves. So there has been a lot of work at the local level and the global level, but also sometimes at the regional level, because we could support also from the regional hubs. We have at the UN, we have regional hubs, which we have actually activated to really be able to support countries immediately before even the lockdown. Over to you.
Excellent, thank you. And I think you frame it out in sort of a beyond supply chain, what are the conditions with which you can make these things work, right? And when you're working with local communities and localization and priorities, that's certainly a way, but also, and many study after study have shown this, that the framing of, if you ask women what they want, there was a big report what women want. The number one thing that comes up world over, rich, poor, able and disabled, it's dignity, right? And it's the framing. When you walk in sort of with that framing, that makes all the difference, and then the tools and whatnot can be adjusted. So Paul, you talked about getting out in front of the travel restrictions and heading to China and then to Uganda right before that set in. What are you seeing now on the ground, talking to your partners and your colleagues with lockdowns and travel restrictions in Uganda and AFRIpads more generally?
Yeah, I mean, it's been really difficult. I mean, when we got back from, or when we sort of thought the issue in China was resolved, then you know, COVID started coming into East Africa, and I have to say the government's taken an incredibly proactive approach in the sense that within the first few reported cases, they already started to take the pandemic very seriously and started to lock down, and this has greatly helped the spread of the virus so far. I mean, in Uganda, there's less than 300 cases right now. But that came with a lot of restrictions. Airports were closed, no commercial passenger flights in and out, borders were closed, only allowing citizens back in, total restrictions on public transport, private transport, and the biggest thing for us as AFRIpads was there was no movement allowed between people's homes and places of work, which meant that as of April 1st, our factory was shut down. So the entire supply chain was then sort of at a halt. We have an amazing staff. We have an amazing team of people in southwestern Uganda where our factory is. And the president of Uganda actually put out an idea of if factories want to stay open, you could sort of camp at the factories, meaning that employees would have to live in the factory for an indefinite period of time and not travel between their homes and places of work. And we thought it was impossible because the vast majority of our workers are women and have kids and families they have to look after. So we thought it was impossible, but we put it on the table. And I mean, to our just emotional delight, they, with 65 workers before the conversation was finished, had signed up. And what they realized, and this is what so many companies around the world are going through right now, like it's everywhere. It's not only in Africa, it's in the US, it's in Europe, is that if they didn't continue working and producing product, it's not only their jobs are at risk, all 175 of our employees' jobs are at risk. The local economy that relies on us, you know, of all the people, you know, sort of contributing, you know, that was at risk. And the big thing for them, which was really touching, is that, you know, we're using this term, periods don't pause for pandemics. And they also realized that if they stop manufacturing the product, then, you know, girls and women in vulnerable situations would not be able to access our product. So I'm very happy to say that since that shutdown happened and we were able to come back to work, we've produced and delivered over 75,000 kits to Tanzania, South Sudan, UNFPA in South Sudan, Ethiopia, and Malawi. So it's been incredible. But I think the one thing that I just really want to address, and it's actually one of the questions that is on the panel right now, is from George from Plan International about sourcing raw materials from Africa. We've tried that, you know, since the very beginning. It was our dream to be able to source locally, and but the type of fabrics that we needed were not available, and the factories that can produce the machinery are not available in East Africa. So we were actually forced to go overseas to get our raw materials, unfortunately, because that was not our original intent. But this brings me to sort of a bigger point of like how we can pivot, and it goes also to Dr. Henia's point of localized sort of procurement and localized supply. I mean, COVID so far in Uganda and East Africa has not reached over 1,000 cases in any country in East Africa. Hopefully, we pray that it has been, you know, the actions that have been taken by governments will help bring down the spread. But the economy is devastated. I mean, companies are reducing salaries, laying off employees, shutting down completely. I think that this is the opportunity. We have an opportunity, both in private sector and public sector, to relook at how we do business together. So I have a bit of a call to action, because I know that there's a lot of organizations like UNFPA, Plan, UNICEF that are on this call right now. Traditionally, procurement has been done in one way, which is procurement is based on two factors. One is quality of product, which is always incredibly important, and it's usually a pass or fail. Either you meet the quality standards or you don't. Second is price, and the lowest price wins the bid. And that has, I understand it, has helped create a competitive global environment for NGOs and organizations to be able to get the best value for money. But what's never being taken into account is what are the trickle-down economics. I know that's maybe a you know, coined term, but like trickle-down economics that come from buying locally. I mean, if you were to buy locally, you would be creating more jobs. The companies would be paying more taxes locally, contributing to the country. More innovation would be coming into the countries as well. And I mean, this is developing the countries that organizations are trying to work in the first place. We're always up against tenders, you know, with other products that are from India and China and all around the world. And yes, the fact is you will have to pay, organizations will have to pay 10 to 20% more for local procurement, because as a social enterprise and ethical manufacturer, we provide healthcare for our workers, we provide meals at the factory, we give salary loans. We've even built a daycare at our factory at the moment. So when women come back from maternity, they can bring their babies and breastfeed. Manufacturing, and as we talk about supply chain, manufacturing is right in the middle, right? Like it's between the upstream and downstream. And I think that one big thing is it's so competitive. And what's not being addressed in the evaluation of so many tenders across, especially Africa, that's where my experience is the importance of local manufacture. There's billions of dollars going into the relief industry. Imagine what would happen if that money could stay in the countries where the help was needed, and to help contribute to not just AFRIPads, but so many companies that are doing this. So I think that if we talk about how we can recover, what will be what would be needed to recover from COVID, it is going to be helping local economies, and that can be done by changing procurement. And I'm calling on this group because also it has to come from the top, from funding organizations. So the organizations that are funding the local, national NGOs and organizations, their offices, you can be the ones to say, hey, let's put a 20 to 30% evaluation weight on local procurement, because that will have a huge effect. I think if we buy local and support local businesses, it will help us recover from COVID, or at least what we assume will happen in effect of COVID in East Africa.
If I can, may I interject here to Paul's point? You know, we have actually issued a global fast-track procedure for local procurement for all our offices immediately when we recognize that COVID is going to stay and it's going to be an issue. We immediately did that. So every country office where UNFPA is located currently, they can procure locally anything they need to do in order to support the women and girls. Over to you.
Yeah, I think so. You've both picked up on something really interesting, and this conversation has entry points around the gender equality work. So I sat around a table a year and a half ago, and there's a big movement around with these massive businesses. BlackRock was there, and tech industries, and like these were Canadian big business, and they were all talking about, you know, a 5% shift in procurement policy to focus on women-led businesses and women-run businesses. But some of these ethical considerations, Paul, that you discussed, like the impact if the world's top 20 companies, top 20 organizations, top 20 donors, whatever, were to do that, could be profound. You know, and I think that is a really interesting framing to start coming up with some of those green solutions, those solutions that are a little bit outside of the box and that are part of that build back different. Because we talk about build back better, and I'm worried that that's gonna get away from us. I think we have to really acknowledge that better will require fundamental shifts. I wonder, Henia, if Dr. Henia, if you just want to speak to that a little bit. Paul jumped into that question, but before I move to the question and answer, to that build back differently, build back better question, what are you thinking about at the UN, UNFPA?
I think, you know, like at the moment we have been working, just before I came to this conversation, we were working on a guidance note on localization to make sure that, you know, local organization, local community-based organization are, you know, are empowered to be able to do the work, and that, you know, we weave some of these issues and we give them the support that they need in order to support their staff to be able to do the work while taking all the measures of like to protect themselves, but at the same time to be able to do the work that they need, which goes back to the getting the economy back as soon as possible, building better and building more contextualized to the local context, instead of coming up with parachuting things or coming things up from somewhere else that basically will not really sometimes culturally sensitive or sensitive to the context of the community. So from our side, building better and making the support locally engineered and locally manufactured if possible, because that would be the way forward in the future. I think COVID have really made us understand why it is important now to really focus back on what is important, which is locally in manufactured, locally led organization to take on the lead, and not really having a system that is really not balanced, where it is always happening somewhere else and we bring things to the people when the people can already do things at the local level in a very better way than what we think it should be. Over.
Thank you so much for that. I'm going to jump into, I think we have time for 2 questions if we speak fast, so I'll give one to each of you. But I've heard consensus there on like this manufacturing question and sort of procurement question. So CanWaCH can commit to digging in and doing some thinking on that and sharing back to our 100-member organizations about, you know, maybe some ideation around where we could go on that. So some specific questions. Highest number of refugees, this is for you, Paul, are settled in Uganda. How do you approach this particular and marginalized segment of the population as it relates to health education and the supply of kits, so specifically in Uganda?
Yeah, that's a great question. Yes, Uganda hosts one of the largest populations in the world. It's because they have incredible policies for refugees. They give them rights, they give them land, they give them opportunity, which in so many other countries, refugees don't get. So the government of Uganda has been extremely progressive in that. I think for us, we work together hand in hand with our partners, UNHCR, UNFPA, there's so many organizations that are on the ground, IOM, working with all the refugees. And I think one of the biggest things that we wanted to ensure before we went in with our product years ago was acceptability. We actually undertook a huge pilot project with UNHCR in Uganda to ensure that reusable sanitary pads, which was something that was quite new on the market, was something that was going to be acceptable to refugees. And we came back with incredible results. You know, just the idea that they wouldn't have to worry about constant distribution as they would with disposable products. The product was locally made, we're certified. You know, women just felt like they prefer the product over many others. And that gave both us the security and UNHCR to know that they were giving out something that women want. I think choice is something extremely important that is overlooked many times in relief situations. And it's understandable because it's not an easy situation to make sure we can cater to everybody and what they want. But I mean, we can do these things to ensure that we are supporting women in the way they want to be supported. And for us, education is key. I mean, I talked about the holistic product. We provide free education to all of our partner organizations. So we distributed over 150,000 kits through UNHCR in Uganda last year, which was followed up with training of trainers to all the different sites that were being supported with the products, to ensure that women in the community, community leaders, school teachers, headmistresses, and girls understood sort of, you know, not just the use and care of the product, but also more about reproductive health and MHM. So education is just so key to go alongside of a product.
Yeah, thank you, Paul. And I think I want to turn it over to Sussanne, so you get, it was worthwhile for you to stay on this whole time for the final word. I wonder if you can just quickly reflect on some of the things that question of kind of the global movement and how you see it connecting into the Canadian and domestic movement, and any final parting hopeful words.
Sure. Thanks for that. And so so great to be on this panel. It was not a hardship to sit and listen to the two panelists talk about the incredible work that is happening globally. And I think, Julia, you said it very clearly that, you know, there's more similarities, there's more in common than there are actual differences, regardless of where the issues are happening in the world, right? And you know, it's those things that we need to really hang on to. It's those things that we need to, you know, use to push things forward where we can, you know, because I mean, there's a lot of work to do. There's a lot of really good ways to do work. Some of it is, of course, you know, what we're finding here through public policy, right? And pushing public policy to change, right? This should just be a fact of life. You know, we often say like toilet paper in the bathrooms, right? That type of thing. It's just basic, right? And that doesn't matter where you live in the world. And so that piece is, you know, so you try not to get too political here, but, you know, part of it is about electing people who will support public policy, right? You know, and knowing those things. And you know, I mean, there's so much great work happening, and it's so good that you folks are bringing us all together to collaborate, work together, push the agenda forward, and continue to normalize this conversation. I think that's probably, you know, the most important piece, is just talking about it, right? You know, we honestly, if you had asked me 10 years ago as a 46-year-old woman if I would be talking daily about period poverty or menstruation, I would have said no. Like, I mean, it would have seemed a very unrealistic thing for me to do. And I grew up in a pretty open home where it wasn't like taboo or anything in my own home, but the world is not there yet, as we know, you know, just talking about it makes a huge difference for people, and finding allies of, you know, folks like, you know, we've got Neil Adolf on the call from the United Way of Lower Mainland, you know, and finding you know, allies from people who don't menstruate, right, to talk about it as well. So I mean, the list is long, but thank you so much again for pulling us all together, because it's such an important conversation to keep having. So
thank you so much. With that, it's 2:02, so I have to close this off, but I couldn't have said it better myself. So thank you so much to everyone. Amazing interventions, and we at CanWaCH are committed to following up and continuing to elevate the conversation. Thanks, everyone.